I'd like to welcome you to BOI Meets Wellness, a podcast that discusses the complexities, celebrations, and challenges of building a wellness ritual as a BOI, a person who is born obviously incredible. You are now listening to BOI Meets Wellness with poet, motivational speaker, and wellness lover, Evolve Benton.
BOI, born obviously incredible, especially when you wear it pretty.
Happy Friday, BOI Meets Wellness community. First off, I want to thank all of my new listeners. If you enjoy our episodes, feel free to head over to Apple Podcasts and leave us a review. We would really appreciate it. Today, I'm excited to introduce Doc Miller to the BOI Meets Wellness community. But before I jump into the interview with Dr. Miller, let's jump into our well-being tip of the week. This week, I want to talk to you about goal setting and focus. It's important that we are intentional about the words we use and the goals we are setting for ourselves. But why is this important? Goals give us something to live for. It helps us to see progress in our lives, and it also gives an opportunity to measure our follow-through. I guess the next question is, what's the best way to set a goal? I would say that there are several ways to set goals, but the way that has been the most successful for me has been to set a goal with measurement, evaluation, and visioning. For instance, thinking about time as your measurement. Let's say your goal is to do 100 push-ups daily. However, presently today, you're only able to do 50. In order to measure that goal, we would have to set some type of intention of a future date of when we want to be able to do 100 push-ups and evaluate that as we go. So let's say it's 2 weeks later and we're able to do those 50 push-ups, but now really easily. Maybe we add on an additional 10 to push ourselves. 2 weeks after that, maybe we increase it by 5 until we meet our goal. The other thing that is key in this is to review and remind yourself of the goal that you have and evaluate the progress. For instance, when we're doing the push-ups, let's say that we hit 60, and we find ourselves stuck. Or maybe we hit 75. We find ourselves at a stagnant place. Maybe you need to increase your reps or maybe get in more rest during the week. We have to see and how to evaluate in order to measure our next step into our goal. Also would suggest writing it down. For instance, writing down, my goal is to complete 100 push-ups nonstop in 4 months. Write the goal, put it somewhere visual so that you can see it daily. Or you can put up a photo or image that reminds you of that goal. Perhaps once you hit those 100 push-ups, you're starting to prepare for a ziplining trip with some friends. So you put up a picture of yourself ziplining to motivate you to get to that progress. So yes, my well-being tip for you this week is to set a goal, any goal, but only one. In fact, focusing on one is sometimes really the key. Set the goal, measure it, evaluate, and vision. Today's episode is brought to you by Mar Media Productions. Mar Media is a production company that produces, publishes, and uplifts the stories, art, and journeys of queer and trans people of color and the people who make our lives incredible. If you are feeling incredible and ready to set some goals, head over to boygearstore.com and grab a new Boy Signature notebook to write your goals down, or some other amazing apparel that we have. That's boygearstore.com. Use code PRIDE to get free shipping on all orders over $75. Now let's jump into our interview with Dr. Miller. This incredible being we are tapping into this week, Dr. Miller, is a PhD prepared nurse and pediatric nurse practitioner with over 15 years of experience in healthcare and nursing education. She is currently tenure track faculty in the CSU system and teaches in their doctoral programs. Dr. Miller is also the founder of Starter Nurse Academy, a digital workforce development company for new graduate nurses. Let's welcome Dr. Miller to the community. Welcome, world, to BOI Meets Wellness. I'm extremely excited about today's interview with Dr. Miller. Dr. Miller, can you just introduce yourself to the BOI Meets Wellness community with your name, full name, location where you're at right now during these COVID-19 times, pronouns, and what brings you joy?
Ooh, I love that last part. Thanks for having me. My name is Dr. Sharrica Miller, and I'm based out of Southern California in the Los Angeles area. And what brings me joy? I think I bring me joy. Yeah. I bring myself joy, and it's very intentional. Yeah.
That is beautiful. So when I found you on social media, which I think that's the power of this social media land and space we're in right now, I was so excited to see a Black nurse with a PhD. So, true story, my mother, rest in peace, was a registered nurse, and that was one of her dreams,
Oh,
right?
really?
Yes, that was one of her dreams, to get her PhD and to do this work. So when I found you and I seen you, it's so much resonated with me. And then you're in LA, I'm from LA, so I was just like thinking about how, even if it doesn't happen for your ancestor, like how we're all connected, and how the
Wow.
manifestation of what you're doing is so powerful for me to see, but just so powerful for so many other Black masculine center boys, folks, to see in this world. So I really just want to thank you for your visibility and for doing the work. And I just wanted to ask you, like, why nursing? Like, what led you to that path?
So I think I always knew that I would go into some sort of like service industry. I think I thought maybe I would go like public service. I thought maybe I would be a teacher, an elementary school teacher. And then, I started looking at how much they got paid. And I'm like, okay, I'm coming, out of foster care, out of Compton. My younger siblings are still there. I need to do a major where I can graduate with this bachelor's and make some money. So I didn't feel like teaching would be the route. And I also didn't really want to go to medical school because I didn't want to take all of that time initially. Then my dad got shot in July, right before I was set to go off to Howard for undergrad. So I was supposed
Wow.
to go in August, and he got shot in a drive-by shooting 4th of July weekend, and one of my brothers died, and it was just like this whole thing. So we're at MLK, Martin Luther King Hospital, in Compton, level 1 trauma center, right in the hood. They used to call it Killer King. And that's when I
I
really
remember
got
at
to.
Killer King when I was younger. I was like, nobody, if anybody gets shot, they like, don't take me to Killer King. Just
Yeah, but see, that's what people think. But as a sidebar, Killer King was like world renowned level 1 trauma center. It's just most people's coming in there half dead, but that has the best trauma center. You don't want to go to another hospital that might be, you think it's all that, but how often are they seeing gunshot wounds? So
mm.
so we go there, and I think that's when I really got to see what nurses do. And I think that's when it really, because I still was considering maybe I will go to medical school or maybe even physician assistant, but I got to see nurses up close, and I got to see how they made me and my family feel, when they took care of us. And I think that kind of settled it for me. So I went into Howard at that point, pretty much knowing I would do nursing.
That's a very courageous story. So I think that what people don't understand, and I've had some amazing experience with nurses, probably because my mom was a nurse. A lot of folks in my family are, is like the labor and the work that goes into being a nurse. I mean, I remember being like 7 years old, watching my mom study, helping her with like flashcards, and then her also dealing with so much of the bureaucracy, so much of the sexism and even racism within the field, So can you just talk a little bit about like some of the challenges and the ways that you've been able to like push through them, and then also some of the celebrations of being a nurse?
Yeah. So when I first graduated from Howard in 2005, I came back home to start my career as a nurse. And I had like straight backs and, really baggy scrubs and Jordans. And I'm Black, and I'm just still kind of raw around the edges at this point. And I had an opportunity to work at UCLA or Cedars. And so these are kind of big institutions and kind of a little bit wealthier neighborhoods. And honestly, I was just too scared. I felt, that I didn't belong in that patient population, or, and I didn't feel comfortable. Although I had done an externship my junior year at UCLA, that experience just kind of rubbed me the wrong way. The way that the nurses seemed to always doubt me, the way that the patients seemed surprised that I was in nursing school and working on my bachelor's. And I just had kind of a negative perception of that. And so I ended up starting at Long Beach Memorial because I felt like, okay, now here I see my people. I see my Black and brown people. I feel more comfortable here. But even still, in terms of fitting in with the other nurses, I just didn't fit in. So I didn't do anything social with them. I had a good rapport with them in terms of a working rapport, and I was able to easily prove myself quickly, but I didn't really deal with them outside of that. And so I think for me, nursing, especially when I did bedside nursing, has been pretty lonely because there were very few nurses that looked like me, that could relate to me. And even when I found Black nurses, but they weren't, part of the LGBTQI community or masculine identified, or masculine identified. And so it was still a very lonely place. In terms of some of the celebrations, has definitely been the impact that I feel that I've had on nursing students through education. I've been teaching for the greater part of a decade at bachelor's, master's, and doctoral programs, and even associate degree programs. And my students come back, a decade later and find me on social media, like you were talking about the power of that, and tell me what an impact that I had on their career. And so I think that's probably been one of my biggest celebrations for sure, is the impact. Of course, I've had career milestones that I'm proud of, but overall, I think it's the impact that I've been able to have specifically on the students. I think so.
That's beautiful. That's beautiful. I actually work at the University of California, San Francisco, here in the Bay Area. So I work with medical students during the day. And it's so interesting to see just like their lack of empathy sometimes. And I feel like they get a lot of that compassion and empathy from the nurses that they work around. But what I was speaking to my students about recently, about how important it is to come not just from a full cup, right, when you're stepping into the hospital and into these spaces, but an overwhelmingly full cup, right? Like you want to be overwhelmed with energy and with compassion and with love. So it sounds like you're busy, and we can jump into some of, the other work with your entrepreneurship, but how do you stay well during this time? Because, it says BOI Meets Wellness. Like, how do you stay well? What is your well-being practice? And is there any advice you would give to other folks in the health sciences about well-being and even burnout? I mean, people don't like to talk about that word, but I think that we're really seeing a side of it, especially with COVID, and folks being pushed to work very, very difficult hours.
Yeah.
Yeah.
So I think for sure one practice I developed early was leaving it at the door both ways. Meaning when you leave from home and you go into the hospital now and you're working with your patients, being very intentional about being present right then in that moment. And whatever you had going on at home, you know what I mean? You kind of leave that at the door and you come to work and you're fully present and you're there and you're constantly grateful and reminding yourself. I did pediatrics, and now I'm a board certified pediatric nurse practitioner. So I've always worked with kids and families. And so just, really being intentional about being present with this mother or this father or this family who has this sick, dying child. And, I'm over here stressed out about a relationship issue or, a minor annoyance of my tire being flat. And so being very present there, but also, and this is where I think the burnout comes in, is also leaving it at the door the other way. And so when you leave from out of that hospital setting, you're not still thinking about that dying child and that family, that you're leaving that at the door so that you can be home and fully present for yourself, your family, your partner, your friends, etc. And so I think that's definitely one way that I've avoided burnout. Additionally, I have always been very intentional about, I feel a little sense of entitlement. And I know people often look at that as a negative word, but I feel in terms of my career, I was just doing a stress management workshop talking to them about this. And I feel entitled to work at a place I love. I feel entitled to work for a company or institutional organization that values me. I feel entitled to be happy at work. And when I'm not going to stay, So I'm very intentional about the jobs that I work. And for me, I have passed up money a lot. So I think that becomes part of it. If you're really chasing the money, it's no knock on you, no shade, but you're chasing the money and you're going to burn out because you're working 4 and 5 and 6 shifts, and working for these places that don't value you or just kind of trying to crank work out of you. Whereas I will take a lower paying job if it's at a place where I love and I'm happy and that fills me up and I don't feel burned out. So I've always done what I love to do, and I've always worked for places that valued me. And I've always learned to set clear boundaries when I'm at work, not thinking about home life when I'm at home. And then I do my 10-minute practice in the morning. So every morning, the first 10 minutes of the day are for me, before I check in with my partners, my kids, my students, my social media. I check in with myself first. And I say all of the things to myself that, I've either said to other people or wish they would say to me, like, it's going to be okay. You're going to have a great day today. You are amazing. This goal that you're working towards, you can do this. I know yesterday was a hard day. Today will be better. I'm here for you. Let's go get the day. So that's kind of part of my practices.
That's beautiful. I have a similar practice where I try to give myself gratitude. I feel like we have to parent ourselves, I was telling my partner that recently. I'm in my 30s now, and it's like the deeper I get in, I'm like, this thing is just all about parenting and pumping yourself up and keeping yourself
Yeah.
motivated and putting self-love first. So who are the people in your life that make your life incredible? Like if you had a gratitude list and some people to thank, because I know you mentioned in your story and even in your bio, growing up in foster care. And often folks think that because people are in foster care, like there's a lack of attachment, a lack of mentorship. But to me, it sounds like that's not here in this story. So who are some people that are on that gratitude list and who have made your journey incredible?
Yeah, I think there's usually this misconception that individuals who have spent time in foster care don't have a strong attachment to their parents. And that's just not true. My mother had a substance abuse problem, but was a really great, loving mother. And the thing about my foster care experiences is that I bounced back and forth a lot. So I would go home for a year, then go to foster care for a year, then come back. So I still had a very, close relationship with my mother. And she is definitely one of the people that, make my life great and bring joy. She was always big on education, always very loving and very physically loving and emotionally loving. And so she has been a big part of my life. My brother, who is a year older than me, we kind of had the same foster care experiences, and he is really my lifeline. If I had to say kind of one other person that is probably the most important part in my life, obviously I have a child, but besides her, in terms of an adult that has an impact on me, is definitely my brother. He's my moral compass. He's also a nurse. He's working on his doctorate. And my daughter really kind of centered me. She's 4. And kind of showed me what it was all about and like slowed me down. It made me really think about how I'm living my life intentionally because she is, watching me. And I have a very, very supportive village and circle of friends that definitely bring me a lot of joy. My students are certainly, oh my God, such a big part of what bring me joy. And then I would say my mentees and mentors. And so I have people that really believed in me and took me under their wing and are bringing me along. And then I have other individuals, mostly former foster youth or who I mentor, who I'm trying to bring them along. And I think collectively that makes, for a very strong village. And I'm grateful for that, for sure.
I shade all that. Those are some beautiful folks. Yeah, I totally remember seeing this picture with you and your daughter and just fall in love with your love, and the fact that you showcase her on social media, which I think is like so dope, like to show that
Yeah.
bond.
Yeah.
So I watched that video you did at UCLA about why should you get a PhD. And
Okay.
yeah, I watched it recently, and I was like, wow, this is so powerful. This is a very unique way of looking at a PhD in nursing. And honestly, before I seen you doing this, I hadn't really heard a lot of people talking about it. I mean, I know it was my mother's dream. I have aunts that are nurses that always speak about it. But why do you think that's important for the folks who haven't seen the video? Why are you pushing this? And then also, tell us a little bit about the Starter Nurse Academy.
Okay, so in terms of the doctorate in nursing, less than 1% of nurses have a doctorate. And so that includes the PhD and the practice degree, which is called the DNP, the Doctorate of Nursing Practice, which is more for the clinical aspect of things. And I think it's important because people typically look at the nursing profession just from the bedside. And so they're looking at it like, yes, I know what a nurse is. A nurse is a person who passes medications, and does this. But a lot of people aren't aware of sort of the behind the scenes and the fact that there are nurse leaders and nurse advocates. And like, who do you think writes our textbooks or, does the research on the best practices or writes the boards for nurses to graduate? And so, to be this idea of nurses being leaders and advocates and change makers and thought leaders and being innovative and using science and technology to innovate and change healthcare, who better to do it than the people that are spending the majority of the time with the patients? And so I think that it's important for nurses to consider, getting that doctorate and to really think about their role as being so much bigger than the bedside and them being a voice in healthcare and healthcare policy. And recently, Trump just did an interview, or he did some sort of press conference where he was in his office and he had a bunch of medical professionals standing around him, and two of the individuals were nurses. And I think that is very critical for nurses to be the ones on the front lines talking about how the PPEs are affecting them during the pandemic, et cetera. Why not nurses? And I did a commercial, and I'll tell you about Starter Nurse Academy, but I do want to mention really quick, I did a commercial for LinkedIn, and they were discussing heroes. It was part of their heroes campaign. And they cast, I got reached out. They reached out to me for the commercial. I went and did it. And when I got on the set, they were like, "Oh, here's your scrubs." And I was like, I haven't worn scrubs in years. I am a nurse leader. I'm a nurse advocate. I'm an educator. I wear regular work clothes and sometimes a lab coat, but I don't wear scrubs. And so they were like, yeah, but you're the nurse, and I'm like, no. I'm going to wear my regular clothes. And so when I got on there, what I talked about was how nurses are advocates and how nurses are foster youth advocates and how important that is for nurses to, advocate for the health and well-being of youth in foster care. So I took it like a whole different angle than what they were used to, because I want to expose that part of nursing as well, as professionals.
That's hella powerful that you went in there and you said, wait, hold up, LinkedIn. I appreciate this opportunity. Let me school you real quick. Let me show you a little bit of something different.
Yeah, they also try to give me a purse. Oh, and that's a whole different.
Oh, Lord, LinkedIn, Lord.
And I want to emphasize that this wasn't a commercial like I was cast as a part. It was me saying, I'm Sharrica Miller. And I had one of my mentees in the commercial with me, my actual mentee, who's a foster youth at the university where I teach. And so this was like my real life. I'm not being like casted for a part. So they brought the little purse and I was like,
Nah, they was trying to mess up that Doc Miller brand real quick. Nah, we not having that over here. Nope.
So I literally brought my own clothes. I wore my own. They kind of restricted what I could wear. They didn't want me to have too much pop on them, so I just wore, But I basically wore my own clothes. I was like, I will go home and get my own clothes and come back, because I also didn't they didn't know what to put me in. Like, well, we have some women's suits here, and so see, okay. I wear a polo and some pants, and you know what I mean? So anyway, Starter Nurse Academy is my company that launched 7 months ago, and it's a professional development company for new graduate nurses. And basically we provide resume, interview, and LinkedIn training for new graduate nurses on a digital platform, in the format of e-courses, e-guides, and virtual workshops. So we actually do in-person workshops as well, but obviously because of the pandemic, most of our workshops are now virtual. And that's been an amazing adventure for me starting that business.
That's hella powerful. When I clicked on that, I was like, this is so useful, especially for today, right? Like thinking about the class of 2020 and folks who are graduating in this climate where folks aren't able to go on interviews, and it's a lot of like digital ways of being connected. It's so important to be on LinkedIn now. So a lot of folks are usually confused, and I was confused about this. I'm still honestly sometimes confused. What are the different routes you can go as a nurse, right? Like, because I know that there's registered nurse, and then there's like LVN, and then you have the PhD. Can you break that down for folks who might be interested? And are all of those folks eligible to work with you at the Nurse Academy, or are you looking for particular folks?
So definitely Starter Nurse Academy is for new graduate nurses, specifically LVNs and RNs, but I'll back up. So I actually started as a certified nursing assistant. So that's a CNA. It's usually a 3 to 6 month, actually you could do it a lot sooner, probably a 3-month program where you learn basically how to do basic care for patients and take their vital signs, which is their blood pressure and things like that. You can work in hospitals and nursing homes, and you'll make I don't want to give a dollar rate, but you're making definitely over minimum wage, but not a whole lot. I think like maybe I don't want to give them out because I don't know. So then you can move up to LVN. So LVN, we call them LVN in California and Texas, but the rest of the country calls them LPNs. So it's licensed vocational nurse or licensed practical nurse. Those programs they could be 1 to 2 years. And the main difference between them and an RN is the setting that they can work in. So mainly in the hospital, you're only going to see RNs. LPNs are typically in clinics or nursing homes, and they're just restricted in some of the things that they can do. So it's still a good route to take. My sister just graduated from an LPN school. Excellent route to take, particularly if like she's a single mother, and needed a program that she can get through quickly. With registered nurse, what's confusing is that you can get your associates or your bachelor's, and either one of them will still take the same boards and still work in a hospital side by side. The difference is magna status hospitals, which are those that are highly ranked and are recognized for nursing excellence. Those hospitals are really only going to take bachelor's prepared nurses. And those nurses take extra classes in leadership, in research, in community health. So they're considered they're well-rounded, and they have a better understanding of evidence-based practice. And so the research actually shows that when you have bachelor's prepared nurses, that you tend to have better outcomes with your patients. And so the big hospitals like UCLA, they will only accept those BSN prepared nurses. From there, you can get your master's and become a nurse practitioner. So that's what I did after I practiced maybe 5 to 7 years or so, and then went back and I went to Cal State Long Beach and became a pediatric nurse practitioner. And in that role, you are a provider. So you could essentially have your own clinic. Depending on the state, some states allow you to practice on your own. Some states you have to have a physician on signature. Some you have to have a physician on site. But either way, you could bring your kid to me. I see they have an ear infection. I could write the prescription, send them, etc. They're obviously limited, and so if the kid came in with a cardiac problem, I would refer them to a cardiologist, a doctor. But for primary care things, and they also work in acute care settings in the hospitals, that's what nurse practitioners can do. And then from there, that nurse practitioner can get a doctorate in nursing practice, which is basically teaching them to be the most effective clinician they can be and to be a leader in the clinical role. Or you can go the PhD route, which is traditionally more for research, academia, conferences, writing textbooks, coming up with the evidence, etc. But both of those routes, the PhD or the DNP, they can both practice. They could both teach at a university. So it's just that one degree kind of prepares you better for it than the other. So that is one of the things that is very confusing about nursing. Is there's so many routes, there's so many ways to get in.
So for the starter nurse, is that mostly registered LVN, or it could be anyone who's in the field that you work with?
Yeah, so I have the Starter Nurse Academy, which is specifically really for new graduate RNs for the most part. But I also have my coaching business, which I've actually had longer than Starter Nurse Academy. So I started first doing one-to-one coaching. And with that, I take nurses all the way from CNA to PhD, because that's the route I've been. I've been through every single stage. So if they are kind of out of that range of new grad nurses, then they just come to me for coaching. But Starter Nurse Academy is specifically for registered nurses in the first 5 years of their career.
Nice, nice. So you're originally from Southern California, correct? Right, as well.
Yeah, from
Man,
Compton, yeah.
it's so interesting to me, like how I'm from SoCal as well, how we all have so many hustles, right? Like,
Yeah.
and I grew up and my whole family, everybody always had two or three jobs. So when I
Yeah.
became an adult, it wasn't even weird to me, like, oh, I'm gonna go write a book and do this. I'm gonna go speak here and get paid. Nothing about it felt abstract, right? But why did you decide to start coaching and doing this? Because, we know a lot of folks who are just nurses, right? Like, that's it. That's all they're going to do.
Yeah.
And they cool with that bag, and that's fine, right? Like, no shade on that. But I think there's a sense of leadership there. So why did you go that route? And are there any tips that you would give to folks who are in a like very serious 9 to 5
Yeah.
profession that are considering picking up a side hustle?
Yeah, I think, my biggest goal in life is to really just get paid for my knowledge, get paid for my thoughts, and to do less physically. Like, I never really loved working bedside and working 12 hours and having scheduled lunches and stuff. And I love now being in an academic role, where I'm getting paid now for what I know. And that's kind of always been my goal. But then you get to a point where you feel like you want even more autonomy than that, because academia does give you a lot of, autonomy and freedom, but then you want even more than that. So the business also grew out of a need, because there were so many people coming to me for advice, asking me to mentor them. And I just, I would spend hours every week, like talking to somebody's cousin. Oh, my cousin wants to be a nurse. Can you talk to them? And then after a while, I started to really feel a little more entitled. Like, I should be getting paid for all of this very critical insight that I'm giving you on how to get into nursing school and how to be a competitive candidate and be strategic and get jobs. And so it really was my little baby sister, and she is the founder of Black on the Job. So she, which is a professional development company for Blacks. And so she brought me on as a consultant, and I started creating e-courses for them, a negotiation e-course, interviewing e-course, a leadership e-course. And then I'm like, I could be doing this for myself, and I could be doing this for nursing, and I'd always wanted to do it, but seeing my baby sister do it, and now my mom owns a business, my aunt owns a business. So I'm like, damn, it's entrepreneurs all in my family. They're doing it. I took the safe route all this way, and I don't regret it, because I have a stable, safe, income coming in that I never have to worry about. But like, I want to be an entrepreneur, and I want to be the one on the creative side and the innovative side of things. So advice that I would give people is to really do it in baby steps. And I'm not really a take a whole leap, put all my savings into the business. And I'm not doing that. I have a daughter, and I have to sustain the lifestyle. I've been a nurse now for 15 years, so I'm not going back to that.
I shaded that.
Yeah, so I just did it baby step by baby step. Like, oh, okay, I'm gonna start coaching. And at first it was just like, DM me if you want the coach, Then I was like, oh, I'm gonna set up an Acuity, Then it was like, oh, I'm gonna set up a Teachable for my e-courses. And so I did it little bit by little bit, and slowly I'm scaling up. So I didn't just take a full-on leap. I did a little bit to put it out there and to test it and to see if there was a demand for it. And I actually had to pivot my business a couple of times from what I thought it was going to be to what they really wanted, was interview and resume. So in my mind, I was like really on some higher level abstract stuff, like we're going to work on emotional intelligence and, therapeutic communication, prioritization, leader. And they was like, but can you help me with my resume? So it was like, all right, I guess I'm be doing resume interviewing. So I think you definitely have to do what the market wants you to do and not necessarily what you want to do, and scale up slowly by throwing stuff out there in the market and seeing what bites, and then going back and building on that and making it better.
I say, you are dropping some major gems over here. I'm over here like in the background, like with my little notepad. You should see me just taking my notes, because I feel like what I really appreciate about this community and this space that my team and I are building is I get to learn from so many different people, but then it also just reminds me to slow down, right? Like, I think often we see the shiny thing at the end, but we don't see the journey, right? So I think that that's what's so powerful about storytelling and being able to tell your story. So I wanted to save this isn't the end of the interview, but probably the end of this segment, to talk about COVID. because you are a health professional. I don't want to start off being so heavy, but what are some of your thoughts on what's going on? Especially with us as a country being so disjointed with what we're doing. What are some of your thoughts? And if you can provide any advice for people based on maybe what you've seen in the hospital, what some of your clients have seen on the best ways to protect themselves, because I think people are hearing a lot of different things, right? Like I seen somebody recently with the gloves on at the grocery store, and I was like, you just sneezed into the glove. Now you're trying to grab an apple with the glove. That's not what they talking about.
So I think, my thoughts on the situation in general is that I definitely think in some ways our country missed the mark in that we have and had solid evidence on how to manage a pandemic. And I think that we just didn't act fast enough, and we didn't use the evidence to our best advantage. And, like, for example, we're 3 months in now and they're barely starting to do tracing and antibody testing, et cetera. And these are things that other countries did and didn't have to shut down or had a shorter shutdown or a softer shutdown. And so I think in some ways that it could have been handled a lot better. But I'm probably going to disappoint a lot of listeners and yourself because I am not at the bedside anymore. I'm just say thankfully, because I didn't really love it that much either. And so I have kind of not even touched really COVID-19. And I've had a lot of people reach out to me specifically for COVID-19 interviews. And I'm like, who should really be interviewing and who you really should talk to are the nurses that are on the front line, the ones that are right there with like my brother is working on the COVID unit. And so, I really have stayed away from like, what are the best recommendations? Because so I can look at it just from standing back and looking at it like, the CDC is giving such conflicting information. How can the public know what is the safest way? And the safest way that I might say today could change tomorrow. And I just really don't want to spread the misinformation because I don't think I'm the best qualified to do that. But I think what gem I will give is sort of how to handle this situation emotionally, in terms of your well-being. And I think that's really what I've been focusing on is my mental health during this. And I think we definitely need a bigger awareness of how this is affecting people mentally. And that, yes, physical health is important. I could go out in the supermarket and I'm risking my physical health because I could get, COVID-19, but also my mental health is important. And so maybe I'm willing to risk that and take a walk in the park or, walk along an empty beach. And I think the fact that liquor stores and dispensaries were able to stay open because those were essential, but hiking trails were closed, just from me standing back and looking at it, it didn't make sense. And I think the data is inconsistent and the messages are inconsistent. And I'm just not even going to touch that one.
Thank you for that, and thank you for your transparency. I think that's real. I mean, even shouts out to President Obama, who recently said, we really have poor leadership, and it's really hard for you as a leader, right, to even lead when you're not being led in the right direction as well. So, and thank you for speaking on, being where you're at as a nurse and where folks are as essential workers as nurses.
But they canceled my. Powerful. They canceled my students. I teach at a nursing school. So we all went online the last few weeks of the semester. And now I had a peds class that was literally supposed to start in a few days and it's canceled. The clinicals are canceled. The hospitals won't let them in. And my students are devastated. So that's kind of where I am. You know what I mean? But I think, honestly, I don't want to take away from the glory. The people who need to be discussing those things are the people that are on the front line actually caring for COVID-19 patients. So my hat's off to them, my brother included, who is on a COVID ICU unit right there on the front line. Him and his wife are nurses and they have 4 kids at home and he's like stripping and showering and you know what I mean? And so those are the ones that need to shine on that particular front.
Yeah, and thank you so much for our essential workers taking care of us, taking care of our people, our family, our community, our elders. Thank you so much to folks. So before we jump into our final segment, which is like a fill in the blank fun time, it's called BOI Talk Hop. I just wanted to ask, for our community, what projects are you working on that you want folks to know about? How can they get involved? And how can folks find you on social media?
Oh, yes. I'm so glad you asked that. So I'm working with an amazing team. Rhonda, I don't know if you know Rhonda, Rhonda's Red Sauce, and Courtney from Sunny Blue Films. And they're actually filming a 6-part docuseries on my life from foster care to PhD. So it's called Still Waters Never Crash. And that's actually the Instagram, Still Waters Never Crashed. And we were about 60% done with filming before the pandemic hit. We were actually had a flight to go out to Howard University. And so what's so amazing about this film is that we went back to all of the sites that were so important to me. So we went to McLaren Hall, which is in East LA. And it was my first residential foster home when I was like 6 years old. And I had not been there literally since I left. You know, we're going to my high schools, talking to my best friend who I lived with when I was homeless, coming back and forth from Howard. And I had one of my other best friends fly out from New York, and we interviewed with her. My daughter's in it, my sister, my mother, you know, so it's really not just like me talking, but we're going to actually go and visit these places and these people that have meant so much. And then going all the way to my journey to foster care. And so it's called Still Waters Never Crash. And we're going to start back filming soon now in a couple of weeks once everything opens back up. And my main Instagram is Doc Miller Nurse Coach. And that's definitely where you can reach me. So that's the biggest project I'm working on. And I'm simultaneously writing my autobiography, which is called Perspective, 12 Lessons Learned from My Journey from Foster Care to PhD. So we're hoping to kind of release both of those around the same time.
Beautiful. Always so much going on and so many amazing things. I will make sure that I put Stillwater and website and all of that in our show notes. So listeners, make sure you go down to the show notes, click those links so that you can get connected and learn more about these amazing projects. So let's jump into Boy Talk and Hop. So this is, this is where you gotta take you. Well, you probably keep the PhD hat on. You know what I mean? It's a little bit more fun though. It's a little bit more casual. So I'm gonna ask you a question, and you just fill in the blank. So the question might be music. Music is, and you might say music is amazing to me. Right?
Okay.
Very, very simple. So the first question is: wellness is
life. Yeah, literally like life, the air you breathe. Yeah.
My favorite food is.
Ooh, crab legs. Yeah, I'm gonna go with crab legs. It's this place by my house called Let's See Bag and Roll, and those crab legs are life.
Nice. So you like to dip it in the butter, or you like the ones that's already in the bag with all the seasoning?
Well, all the seasoning in the bag, and I dip it in the butter.
Okay. I'm with you when you're right.
Yeah.
Money is
not everything. Yeah, money is not everything. And I recognize that I say that from a place of privilege, but I also recognize that I say that from a place of I've been homeless and slept in tents, and so I've come from nothing and now I have something, and it's just still and never has been everything, but it is necessary.
Love is
life. It is the air you breathe. It is also a drug. It is probably the most powerful drug, but it is also life.
If you could speak to anyone, dead or alive, who would it be? What would you talk about, and what would you do?
Maya Angelou. When I first read I Know Why the Caged Bird Sings, and just reading about her and her brother Bailey and their whole life experiences just resonated with me so much. And when I was in high school, I wrote her a letter when she was at Winston-Salem, and she actually wrote me back. And I never got to meet her. She died before I got to meet her. And I would just want to talk to her. I think I would just let her talk, whatever is on her mind. And I would probably just want to hear stories about her childhood and really about resilience, because that's what she means to me, is resilience.
Ownership is
accountability. And I think accountability is an underrated skill. And I think it takes a person with a high level of emotional intelligence to really take ownership over things, good and bad, taking ownership and accountability for mistakes, but also taking ownership for your success and not shying away from that, taking ownership with your beliefs and things like that. So, yeah.
Okay. If you could put together your own versus battle, which two artists would you have compete?
See, you know what? I'm so lame, and I'm not like it. Okay. I would probably put A Boogie. I know, cause see, maybe I'm supposed to have like a real answer here. People that are music heads, don't come at me. Cause I'm with my friend and she was just getting on my case about Logic, and she's like, name one Logic song. And I'm like, I love Logic, so I would probably put. They're not really like the same kind of genre, but I would probably put A Boogie and Logic, mainly because I would know every single song. I haven't really been able to get into the verses that much. But I know with that one, I'd be tuned in from start to finish. Yeah, Logic and A Boogie.
And last but never least, Dr. Miller is?
Ooh, I would say resilient is probably the biggest, is the word that I would use to describe me is resilient. My bounce back game is strong. Yeah.
Ashe, thank you so much for this interview in Space Fam. This has been amazing. I knew your story was amazing, but to be able to hear it really has gotten me pumped up, and I'm so excited to share with my community. I know so many young folks who want to get into nursing and are afraid, and I think that hearing this and being connected to you is going to be powerful.
Yeah, tell them to reach out to me, Doc Miller Nurse Coach, for sure. My name is Dr. Sharrica Miller, and I'm born obviously incredible.
Thanks for listening to BOI Meets Wellness. Stay connected on and off the show by following us online at BOI Meets Wellness. That's boy with an I. Until next time, go be incredible.